It was scary. It was probably more scary than when I was told I had diabetes in the beginning, because then it was diet and exercise, and I thought, well, this will be okay. But when they said there was the kidney disease, that was scary, because I didn't know what to do about that.
The main interest of our research group is in the area of diabetic kidney disease, and this is actually a huge public health problem. We have literally a pandemic of diabetes. And as we have more people with diabetes, they're going to live to develop complications. And one of the most serious and most common is diabetic kidney disease.
In my career, the development of chronic kidney disease and diabetic kidney disease has absolutely skyrocketed. Millions of people. It's just staggering how many people are diagnosed each year. Every other disease seems to be, we're making some inroads on. This one is running unchecked.
It breaks my heart that we have nothing to offer to Cynthia, who's in her 30s. She has no access for dialysis. She failed kidney transplant. She has a 2-year-old child, and she's thinking about giving up dialysis.
I think it's the kind of the hopelessness that it is progressive, that in spite of treatments we have, we still see the progression to end-stage renal disease. And I think there's a huge amount of fear associated with these folks. So many of them identify even by managing their diabetes and their blood pressure, they still are progressing. So research for them is an option that gives them some hope. And we see these people saying, if I can gain from this, wonderful. If I can't, perhaps what's learned will help others that are walking the same path that I'm walking right now.
So you can see there's no difference between AGE.
In the Discovery Science Laboratory, our main goal is to support work in the clinical field, and we work in cell culture looking at a variety of kidney cells and how they're damaged and respond to injury. Currently we have some interest in inflammatory response and in cell death, and have a unique molecule that we're studying. It's serum amyloid A, and it causes death and injury in cultured cells. So this allows us to look at mechanisms of how that may work.
So one of the really great things about being here is that I am allowed to do a lot of different things, and we interact with the whole group. Really focuses on the translational aspect of the science. So in the same building we have basic science people where we're actually discovering the molecular mechanisms of disease, and then we have right across the hall a biostatistics core where we can actually use population data to kind of drive some of our hypotheses, generate those, and also to prove that the research we're doing here in the lab actually does translate to humans. We also have a clinical team right down the hall as well that's actually kind of boots on the ground and recruiting the patients and doing the actual intervention with the patient.
Here we have opportunity to see the patients, people with a real disease, which always remind us why we are doing research. We also have opportunity to offer them to be part of important trials, to learn about their disease and to learn how to help themselves.
In spite of the fact that we have some exciting research in that regard, we have to keep in mind that it's only important if it relates to people. That allows us to collaborate with other investigators in our country and in other countries to look at populations of people and whether or not our findings can initially translate into something that relates to them. And if that's true and can be followed up, then we can come back to the laboratory and explore mechanisms of how that might work in these cells.
Tom, any swelling?
In my left leg. Got into a couple studies. One was reboxistar, another one was vitamin E that was ended later. But those, I think, when we found out later that I actually had the medication instead of the placebo, that was really good news, because my kidney function had really improved on all the lab tests. And you know, I can't tell you that I felt a whole lot better or worse before or after that, but I felt better emotionally when I knew that my kidney function was improving.
I think that Spokane is a wonderful place, especially for people living with diabetes, where healthy lifestyle is so important, where we know physical activity, maintaining normal weight, not only helps prevent diabetes, but among people with diabetes encourages good control of blood glucose, as well as we hope helps to prevent some of the serious complications, including kidney disease.
I hope that we advance research in kidney disease and are able to translate that into usable, valuable studies What we've learned at the bench in kidney disease is incredibly important. We are still lagging in the development of medications and good clinical trials to help ameliorate or slow or reverse the progression of this disease.
But I do think the hope is bright. Some of the discoveries that are being made in the laboratory are absolutely transformative. And now I think some of the challenges will be to first translate those into clinical trials to make sure that they're safe and they actually work as intended. But most importantly, at the end of the day, delivering that care to our patients and using what we've learned through our clinical trials to community emphasis to implement best practices, including the novel therapies that'll really move the needle in this field.